Okay. I'm Dr. Aishwarya Joshi from KJ Somaiya Medical College, Mumbai. Good morning to you all. I would like to present the OCCLUTAB, a novel approach to the treatment of anisometropic amblyopia. We have no financial disclosures. Amblyopia is a cortical developmental disorder secondary to abnormal visual inputs to a structurally normal eye occurring early in life, that is during the stage of plasticity, wherein dissimilar action potentials in amplitude or time or both are generated in the retina which reach the cortex. It leads to reduced visual acuity, poor contrast sensitivity, poor stereopsis, and impaired hand-eye coordination. It is estimated that around 1 to 4% of the Indian children are suffering from this, and the onset varies from birth to 7 years of age. It is 4 times more common in premature babies and 6 times more frequent in children with delayed milestones. It affects the developmental, academic, and social life, and thus it is recommended that it is treated at the earliest. Conventionally, the treatment consists of wearing complete refractive correction with patching of the better eye to promote use of the worse eye. Occlusion is important as as more than 70% of the patients do not regain good visual acuity by just wearing glasses, and the compliance for wearing glasses in children is extremely poor. In a variety of amblyopia treatment devices which are available in the market, only the amblyopic eye is stimulated. Here at the department of KJ Somaiya Medical College, we joined hands with two Japanese universities with the help of Dr. Yang and Dr. Handa. We conducted a study to compare the effect of the amblyopia treatment with glasses with eye patch versus glasses with our open type of binocular OCCLUTAB device. We recruited 28 children aged 5 to 12 years old having purely anisometropic amblyopia, that is a refractive error difference of more than 2 diopter sphere in both the eyes. Any squint, structural or functional abnormality of the eye were ruled out. There were 28 children, out of which 16 were girls and 12 were boys. Their mean age was 9.39 years, and their mean spherical refractive error was minus 4.11 diopters. There were 2 children with severe amblyopia, 22 children with moderate, and 4 with mild amblyopia. It was a prospective randomized trial with 2 study groups of 14 children each. The first group had eye patch training for 3 days, the conventional therapy where a patch was given and 60-minute session was given where the child had to watch cartoon videos or do near work like writing, reading, or coloring. In the second group, the child had to wear complete refractive error correction and was given OCCLUTAB training for 3 days a week for 60 minutes per session at the hospital. Both the groups were supervised. To introduce you to the OCCLUTAB, it is a regular electronic touchscreen tablet with pre-installed touch games to improve hand-eye coordination, but it emits a polarized light. So to the naked eye, the screen appears white, but it has dedicated glasses which come as a set with it. So such that the better eye has a plain glass in front of it, which makes it see a white screen, and the amblyopic eye has Polaroid glasses, which makes it see the colors on the screen. It is easy to operate, and there are thousands of games available to escape the monotony and make the treatment fun. It has the simple Android software and the Google Store from which the child's favorite games can be made available. For this study, the child had to follow up every alternate day for 8 weeks. That is 28 sessions of 1 hour each were given to the child. At the end of every week, visual acuity was evaluated with logmark chart, and stereopsis improvement was noted with Pokemon stereo test, which is a form of a Frisbee test. The results. Improvement of visual acuity of more than 1 line was noted in 8 out of 14 children in the eye patch group in the end of the study, that is at the end of 2 months, and in 7 out of 14 in the OCCLUTAB group at the end of 2 months. For stereopsis, an improvement of more than 100 seconds of an arc was noted in 4 out of 14 children in the eye patch group at the end of 2 months, and 4 out of 14 in the OCCLUTAB group. The patching and the OCCLUTAB group both showed significant improvement in the visual acuity at the end of 1 and 2 months, but no significant improvement in stereopsis was noted, so results were similar. Similarly, on comparing the 2 groups, there was no significant difference in the improvement of visual acuity and the stereopsis in both the groups, so they were comparable. Before prescribing this to your patient, there are a few general considerations to be made, such that it has advantages of being fun, exciting, has better compliance, and it is easy to understand for the parents and guardian, and it has an open binocular type, so both eyes are stimulated. But it also has a few disadvantages, such that it is expensive and not easily available because it is still under studies, and it increases the screen time. Also, for this study, have been made better by increasing the number of subjects which were enrolled and the study duration. This is my bibliography. Thank you.
Dr. Aishwarya,
yes.
I would like to ask you, is this device available in the market, and what is the price? Is it commercially available?
So it is not yet available because it is still under study. And these doctors approached us from Japan to conduct a pilot study first, so that later it can be introduced. So we took our scientific committee approval and ethics committee approval, and then we conducted the whole study.
Yeah, and maybe a longer study can be conducted.
Yes, sir, definitely. But at the beginning, we were not sure about the outputs of it, so we did not go for a longer study and for more subjects. It was more like a pilot study to begin with.
Is it like dioptrics? How is it? I mean, is it something like dioptrics, what we do in amblyopia therapy, or is it something new?
So it basically presents a white screen to the better eye. So it's not that the better eye is fully covered. It is still receiving light stimulation, but the amblyopic eye receives the colors, and it's more of an interactive thing where the child plays. So it also increases the hand-eye coordination, and that is there are many studies conducted where they said that it improves the neuronal network development.
What you're saying that binocularity is still, there's some opportunity for binocularity as compared to when you do conventional occlusion, where the binocularity is sort of evened out. Only thing is your age group is 5 to 12. I think it should have been probably younger age group, because after 7-8 years, the amblyopia treatment is not as good as it is at by 7 or 8 years. So I think that aspect should have been there. And your treatment was for very short time. 8 weeks is a very short time for amblyopia therapy, I think.
Yes, sir, but we were not sure if we will see any improvements, because we ourselves didn't know what it is. But then after this study, now that we know that it is comparable, a longer phase study is conducted currently, and there are children being studied. We just lost out on a few subjects because of the COVID issue, but it is still being conducted, and it might be presented next year.
Maybe we can do this therapy first, and if after that, if it doesn't work out, then maybe we can go back to occlusion, something like that. After you see a lot of money, I think you can go back to occlusion.
Yes.
It's a very interesting study. And if you not compare stereopsis and visual acuity improvement are not always in amblyopia, they may not always run hand to hand, you know. So, I mean, you may have poor vision and stereopsis may be better. It's not always a linear relationship.
Yes, sir. That's